was the U.S. change in climate where, obviously air pollution is dropping and then all other things are rising. And I'm wondering if there's kind of an inverse graph for third world countries when those policies were enacted. I'm thinking of like our recycling, for example, how we were shipping everything over to China, and now China passed that law that they're not going to accept it, so now it's going to Thailand and other third world countries. Are like super processes that cause a lot of pollution, how we just tend to offshore it. And is that just pushing it on other countries, and that's why our graph looks great, or could you touch on that?
Yeah, that's a great question. And there have now been several really important modeling studies that have shown that we have outsourced a lot of our air pollution. So you consider all the goods that we consume here in the United States, where they were produced. They're produced in places that have much more relaxed environmental policies than we have here. So in a way, we have controlled a lot of our local air pollution through these technological measures, but there's also these broader economic influences that are occurring simultaneously, where pollution has increased in the parts of the world that is producing the goods that we're consuming here. That's a good question.
Maybe I'll ask a question. First, I thought that was a great presentation. Thank you for that. So PM 2.5 is sort of a grab bag category, different sizes, but also we know that the carbon often absorbs metals or sulfur particles, stuff like that. Is PM 2.5 from diesel emission different than PM 2.5 from wildfires? And what do you think those differences mean?
Yes, it is different, and that's really important. That PM 2.5, air pollution is a mixture of different components. PM 2.5 is one of those components, but PM 2.5 itself is a mixture of different components. And the mixture changes based on where you are in your proximity to different sources. So when you burn diesel fuel, the composition of PM 2.5 is different than if you were to burn wood, for example. So yes, we know the composition is different. We don't know whether the health impacts are different. So right now, the evidence is kind of mixed for that, but the assumption that is made in almost all of these types of studies is that all PM 2.5 is essentially equally toxic. We know that there's, not just a different composition of PM 2.5, but there could be different things coated on the outside. It may not be PM 2.5 mass that is driving the air pollution, it may be the surface area, which would indicate that smaller and smaller particles, when you get to PM1 micrograms per meter cubed, the smallest particles might actually be more toxic than PM 2.5. It's an area of active research.
Thank you so much. So interesting. I took a lot of pictures, which I tweeted. So I'm wondering, knowing what you know and having this really high-level global view that you have, and I know that this answer may be highly specified for geographic context, but what would you tell a city decision maker about the kinds of interventions or policy-making endeavors they might engage in order to protect their populations, and how would you make a decision about that kind of advising?
Well, I think that it is complicated, but it's also simple in a way because it can be boiled down to burning less stuff. So anything that will reduce burning is going to be beneficial. And I would say, if I had an audience with an urban decision maker, I would push that message rather than saying, we need warning systems for populations to know when to stay inside. Or we need to, make sure that cars, have catalytic converters or are upgraded to the most, the most stringent air pollution regulations. Those are all good things to do, but they're treating the symptoms. We need an elimination approach, which really boils down to burning less stuff.
Thank you so much. Let me ask you a question sort of more on the medicine side, where you're looking at health damage on your right-hand block. And that is, let's look at a human canary in the mind, as it were, and that is asthmatics, especially pediatric asthmatics. What about the confounding variables, especially when you show the DC graph, grade first, 4, 3, and so forth, in terms of poverty, food insecurity, lunch access to care, and so forth and so forth. How does that confound some of the things you're finding in terms of just air pollution?
Well, I think these are really important considerations. You know, we try to pull epidemiological studies that have the largest population sizes and that have been done in all different countries to try to generalize. But there's only so much generalizing that you can do. I think there's a lot that happens on a local scale. What I think is an important lesson that I've been learning over this course of research is that it's not just about reducing the pollution levels. In fact, it almost is more important to just improve overall health status. So I think that message isn't really coming through clearly in the overall body of literature, but I think this is pointing in that direction. Rates that cities have been investing in air pollution monitoring, given that there's other ways now of measuring air pollution like from satellites. And it's kind of like the Wild West out there in terms of air pollution surveillance at the moment. The air pollution surveillance has really been revolutionized over the past 5-10 years by the advent of satellites, of really good chemical transport modeling of the atmosphere, and low-cost sensors. There's now people just walking around with all kinds of sensors measuring the air pollution around them. And we're able now to pull all this information together and get a sense for what air pollution levels are. But this is a major open question that I think the global community is faced with right now. And we're actually seeing this in our partnership with Environmental Defense Fund, where they're interested in knowing what's the benefit of equipping Google Street View mapping cars, which are out there anyway, with air pollution sensors measuring pollution at the street level. Should we be doing that in every city? And I think that that's still an open question. We have a lot of information now from satellites that indicate that maybe we don't need to be setting up huge networks of hundreds of stationary monitors around every city. Maybe we can use a combination of some monitors at the ground level plus remote sensing plus chemical transport modeling. There's some integration that I think can happen here without every city having to invest millions of dollars in developing new air quality monitoring network.
Yeah, great talk, as always. So I think it's striking to hear your message, and then you turn on the evening news and you hear what you hear, right? I gotta believe that not breathing chunky air and not drinking chunky water is a bipartisan thing. Do you find that your message, when you're speaking to more of a mixed audience, does gain traction? Do you find pushback, or does this resonate with the vast majority of people?
Well, I don't know how much personal experience I have speaking to audiences that are not quite as like-minded in terms of environmental quality. It'd be great to be doing more, because I agree with you that this message is one that is likely resonating beyond the message that climate change has. And I think that's kind of the other point to this, to this line of inquiry related to cities and the local co-benefits, is that not only are the local co-benefits local and immediate as opposed to the global and long-term climate benefits, but these, the air quality is something that everybody can get behind, right? Whereas climate change has, unfortunately, this political, hits a political nerve. So I think it is something that I think can be helpful, but I still think there's open questions too when you talk to non-technical audiences about this. How do you message this so that people understand it? I've heard people say, PM 2.5 mortality, you're telling me I'm going to die because air pollution out there is bad. And no, of course, that's not what we're saying. We're looking at a population level. But people don't understand that. I think the more we can talk, in terms of morbidity outcomes like asthma, and talk about increases in risk versus these kind of stark terms that this number of deaths is going to happen in Washington D.C. because of air pollution levels. We're still working on the messaging here, but I agree with the overall concept that it can be helpful.